Fine, when you think about going to the dentist, maybe you're anxious about feeling pain. Maybe you're worried your mouth will be numb for hours, making eating and drinking a drag. Or maybe you realize you've avoided a dental visit for possibly decades. Today, dentist Steve Marsh is going to calm your fears and update you on the many ways that your appointment will not only be painless, but pleasant. So,
thanks, Lauren.
Wow, that's great. You've got a long list of tips and techniques, right, for tranquil dental visits.
Well, you know, we have a lot of people who haven't been to the dentist for many years and many who come regularly. So one of the things for people who have anxiety, sometimes we make early morning appointments. In our office, we start every morning at 7, Monday through Friday. So some people want to get it done, or they're professionals and they want to get down to work, and they have a lot on their mind, they want to do it early. Another thing we do in our office, and I'll talk specifically about our office, is we like to see people on time. We don't like waiting. No one likes to wait.
No,
it creates anxiety as well. In our office, we have a reception area with things like orange juice and water and coffee. And there's a picture actually in our office, and some snacks, so that, again, if you don't have time to have something in the morning, all these things are all made so that
I hope all the snacks are sugar-free, by the way.
Yeah, they are. So we try to do all we can to make it as easy and nice for the patient. All those things help to reduce the anxiety.
Okay, well, what if all of that is still not enough? What if it doesn't calm the patient down enough?
Okay, so among other things, we always say talk to the dentist and discuss things, but there are things like Valium, 5 milligrams, a very small amount, will help take away the anxiety. You can come to the office, have a refreshment, take your pill, and wait 45 minutes for it to take effect. That's one idea. Certainly, administering Novocaine has become different. We have topical anesthetics. I have some topical right here that we use. It's cherry flavored, it's mint flavored, it works much faster than it used to do, and the dentist should administer this before the injection. And as my father taught me, when you do the injection, you do a little bit at a time. So you give a little bit,
let it get kind of numb before you...
Right, I'm not numbing up the tooth, I'm numbing up the area.
Okay.
And I'll actually use an injector like this. It's very easy, it's very subtle.
It's big.
It's big, but it's just to hold the liquid. There are other things that can make it easier. One is a mouth prop for people who have problems keeping their mouth open.
Okay, you don't have to worry about that.
No, so we have this. So we do all that we can to make it as easy as we can for patients. Another thing we use when people are numb, and it's like you, Laura, you have to get to work and you don't want to be numb for a few hours. We use this, is called Oraverse, and Oraverse is another anesthetic that we administer. You're already numb, so you don't feel it. And then with Oraverse, instead of being numb for 3-4 hours, it may last 30 to 45 minutes. All of these things can be used by the dentist to make things much easier for the patient.
How about when they're sitting in their chair having all of these things done? You've got TV, music, all that kind of thing?
Oh yeah, and that's something we actually have a picture of. And what happens is that we have video monitors, we have earphones, all of these things to make the experience better. We even use, oftentimes we'll use a blanket. And the blanket...
A blanket?
Well, sometimes it's cold in the office. Sometimes just having that blanket around you makes you much more comfortable. So those are all things that can make the experience that much easier for the patient. Here's a patient in our chair watching TV. It happens to be Channel 3 in this case. She has a blanket on her lap. She's laid back. We have a pillow for her neck. All that we can do to make it as easy as we can. And the other thing we do, Lori, is while we're working, we always want to make sure that they're comfortable. We don't want the patient to experience pain. So we'll stop every so often to make sure that they're comfortable. And that's something that all dentists can do to make the experience that much easier.
Okay. Do we have maybe one picture of some?
Yeah, because a lot of people, as we mentioned, come in and they've had this anxiety. They've avoided the dentist for a while. And so we have a couple of pictures to show some patients who have experienced that. This is a patient who came to me. You talked about 10 years. It had been about 10 years. She hated the way her teeth looked, but she couldn't overcome that fear. And so we did some reshaping of her teeth. We took out the old fillings and any decay. She was somebody who actually used a Valium to get through it. Again, sometimes we use this nitrous oxide, which relaxes people as well. We did some gum contouring, did some porcelain veneers, and some reshaping of her teeth. And this is somebody who avoided for years. And here's somebody, she was ashamed of her smile, and that's why she avoided the dentist. Another thing that creates anxiety. So again, in this case, we did gum contouring and some porcelain veneers, but again, used all these techniques to make it a good experience for her, and she's become one of our favorite referral sources because she said she finally found a place that made her comfortable.
Well, and that's good. So now you can be fearless and painless when you have your dental checkup. Ready to schedule your appointment? give Steve a call. His number is next.
See what Dr. Stephen Marsh can do for your smile by calling 440-461-1003 or visit www.clevelandsmiles.com. Next, birthday in a box.